You've heard from me already, but I'll introduce Rebecca. Rebecca is a transition support worker at Royal Children's Hospital. She's also involved with youth engagement at Heart Kids, and she works for the Fontan Registry, so a very busy girl. We are going to talk to you about moving to adult care. And this is based on a study that we did that we're doing as part of our partnership grant. And we did a whole bunch of interviews. We did 18 in-depth phone interviews with young people aged 18 to 30, all around Australia and New Zealand. We had 9 young men, 9 young women participate. And then once we completed the interviews, they were transcribed, and then we looked for key themes in that data, and that is part of what we are presenting to you today.
So, as we can see, transition is not a straightforward process. It looked very different for all young people that we interviewed, but for many, it was a bumpy ride. So the process of transition. So when we looked at our data, we could see that there was no clear-cut demarcation at age 18. And so where suddenly that young person would become independent. Instead, when we look at the process of transition and we looked at our data from the interviews, we were able to see that it's rather a process over time, an evolution as such, between the young person and their parents as that role shifts. And there is a greater independence on the part of the young person, which is not what we could see was not often reached until about their mid-20s.
So young people had a range of transition experiences. For many, this was a period of uncertainty. Some of them said it was a bit scary. 3 of the young people we interviewed had remained with their same cardiologist, so they didn't really experience a transition to adult care. The worst case scenario was when there was a medical emergency which occurred after they had their last appointment at the pediatric hospital, but before they were seen for the first time at the adult hospital. And these experiences were very stressful for the young person and their family. And so that put a lot of pressure on them during that, and not an ideal introduction to the adult healthcare system. A couple of young people started by saying that really, their transition experience was no big deal. But then when we unpacked that a little bit more, it became clear that a lot of them really weren't prepared adequately for transition. So while most young people, when we look at those towards their late 20s, they've adapted to the adult healthcare system. But these bumps in the road, I think, very much increases the likelihood that they might become less engaged with their healthcare. And we know that young people who are more engaged with their healthcare tend to have better outcomes. So we should strive to keep them engaged. Specifically during that period of adolescence where there's an increase in risky behavior and mental health issues can also become more prominent. So a couple of quotes just to shine a light on what was going on. This was a 28-year-old saying it was a bit scary. They had not yet had their first appointment at the adult hospital. I was over 18 years old. I had surgery that was due at that time. It made it difficult on who was actually going to do the surgery. This put us in a really stressful situation as a family. Another 22-year-old told us there was no real formal conversation. They didn't really do anything. I just got a letter in the mail and had my next appointment at the adult hospital. And then this third quote here, I was referred to an adult cardiologist. He was this little old man. His bedside manner was terrible. At the time, I was starting to develop palpitations. He put it down to strange things like it could be due to nose piercings. As a 17-year-old, we just didn't get along.
So as we note from some of those quotes, there was different levels of engagement from young people, and we could ideally say that some of them were definitely lost in transition. So this graph looks a bit overwhelming, but I'm going to break it down. So this diagram shows the different levels of engagement in which can be visualised on a sliding scale. From one end being completely disengaged to the other being completely engaged in the health system. In regards to disengagement, often this was because they were marked as going through what we might say as a rebellious phase, or because they felt fine. In other words, they didn't feel the need that they needed to see their cardiologist. One person completely stopped taking their anticoagulation medication because they were feeling fine. Another young person said, "I went through a rebellious stage." We did note that this rebellious stage went for 10 years. And it said, where I just didn't want to see my cardiologist and I ignored my health problems. We find that there are two ways that typically young people become re-engaged with their healthcare. And this is often through encouragement from a close friend or an external party, a third party, or that young person will experience what we would say is a health crisis. This could be something like developing palpitations and they end up in emergency, which then re-triggers engagement into the health system. For young people who are partially engaged or partially disengaged, their health often takes a lower priority. And this was said to be justified by the busyness of their lives. Things that tend to make it worse is that they don't have a firm understanding of their heart condition or why they need regular surveillance or checkups. In addition, if they had a cardiologist who can relate to them and the issues that young people go through, i.e. nose piercings, then there is a greater rapport between the patient and the doctor, and there is then a greater likelihood that they will stay engaged within the health system. There is also a greater sense of responsibility of keeping track of these appointments, which seem to differentiate those between who were able to stay engaged and who were not able to stay engaged. Oh, still me, sorry, beg pardon. So in relation to that scale, these quotes really show, so it didn't seem like a priority to me then. No one really explained the reason behind me having to take them, said a 24-year-old. I'm really bad with the medical terminology and the details and all that stuff. Yes, he told me about smoking, but not really about drinking or sex or anything.
So one of the main areas we addressed in our interviews was around asking these young people, what advice would you give to other young people who are approaching the transition age? And this was some of the advice from young people to other young people. This included, make sure you understand your heart condition. Can you explain your heart condition in simple language? Make sure you understand why you are taking your medications. Keep track of your medications and appointments on your phone. These days it's much easier, just on your phone. Ask questions from your doctor until you understand. Trust yourself. If you are worried or unsure, ask questions. Seek a second opinion. Advocate for yourself. You know yourself best. If you're not comfortable with your doctor, find someone else that you can connect with. Don't let your health condition bring you down. If it does, seek help. And through places like Headspace and so on. And connect with peer support. Connect with other people like you. We've established our Fontan Youth Support Network on Facebook and other places like Heart Kids where you can connect with other people.
Young people also had some advice for their parents through these interviews. And some of these young people said, you as a parent are integral to this journey and you will continue to play an important support role. This was demonstrated in the transition process chart that I spoke to on the second slide. And we looked at that changing role between the parents and the young person during the transition period. The second and third quote go on to say, on the screen, to help prepare your young person from increasing their independence from an early age. When we look at transition literature, it states that these conversations and starting to encourage greater independence should start from about the age of 12 and onwards. So, for example, you could encourage your young person during their doctor's appointments to ask a question that you've spoken about earlier at home. Reward and encourage independence over time, because it is not a skill that will happen overnight. One of the quotes from our interviews that particularly stood out for us was a young person whose health knowledge was not fostered over time. So this was a quote that was in relation to a mother and a young person with a Fontan. Every time I think I've got it down, I'll sort of go to her and I'll say, this is what I've got. And she says, no, this is what you have. And I swear, she changes it every time. So this is not an ideal example of how that young person is going to build confidence in their health knowledge. However, for the most part, young people acknowledge that their parents have a very important role to play in their healthcare. And as you can see, my parents are pretty amazing, to be honest. My mum was always 100% involved. She still attends, but now she just sort of waits out in the waiting room. She's more just keeping me company rather than sitting in on that appointment. I think they found it hard to let go. I kind of suggested that when I was 23 or so, I could go into an appointment on my own. It's like the world caved in.
So very importantly, in that last point, talking to preparation from a young age for both the young person and the parent. Young people also had some advice to pediatric and adult cardiologists. We'll see how this lands in the room. Talk to the young person as an individual rather than just the parent. This is particularly in the pediatric setting. Prepare the young person from a young age, 12 and up. Moving to adult care shouldn't come as a shock. Address adolescent health issues directly. Initiate discussions around contraception, sex, alcohol, drugs, tattoos, piercings. Check that the young person understands their cardiac condition. Don't assume. Ask them to explain it back to you. Do they understand why they are taking their medications? I think very important, ongoing education of their heart condition at every appointment. Using simple language and explaining the risks clearly, and very much underscoring the importance of regular checkups so that this becomes habit, and when they move to adult care, this is just part of what they do. And then very much transition joint clinics are a helpful introduction to the adult setting. So joint clinics between a pediatric and adult setting, not joints in it, just. This is some quotes from some young people. When the first example is not particularly helpful. My cardiologist wouldn't even know who I was. This is after they visited the same cardiac service for 10 years. I've had a couple of doctors getting really technical with me, and I really don't know what they're talking about. It would have helped if it was explained, maybe, what might have been expected of me. Like when I go to the hospital, I have to do this, and that is my responsibility. If I don't rock up to my appointments, it's not going to be followed up. It falls onto you as an adult when you go to the adult hospital. Just want to quickly mention as well that 50% of the young people we interviewed have moved on from to a different adult cardiologist than the one that they saw the first time when they moved to adult care. And on average, the young people we interviewed rated their transition preparation as 5 out of 10. So, in an ideal setting, this is what we think transition should look like. And when we looked at all the interviews, this is what we took from it. A nice, smooth transition bridge between pediatric and adult care, which features dedicated transition programs for congenital heart disease, and a focus on involving the young person and the parents in transition programs, a strong focus on developing young people's understanding of their heart condition and reasons for medications, early preparation well in advance of age 18, a focus in discussions on adolescent health topics, youth-friendly settings are very helpful, and a holistic focus in particular around emotional and mental health.
So as a result of these interviews, we recognised that there was definitely a need for connection, and peer connection at that. So earlier this year we established the Fontan Youth Support Network in June, and it's a closed Facebook group specifically for young people aged 15 to 25 with a Fontan circulation. Now it has about 45 members in the group, and it's a place for them to connect with other young people just like them and to give each other peer support during this period.
And so, in terms of what remains for our transition work, we still have another year and a half of research that we're continuing. So these interviews form part of that whole process, and we're looking specifically at young people who are now going more through a formal transition process so that we can contrast and compare those experiences. Right, that's us. Thank you.